Sometimes any father-like figures, there's the potential to be emotionally attached to them, I guess. I'm going to be blunt, and I'm going to say this patient is going to die if he does not get critical care input.
That's the real bottom line, isn't it? Am I going to live or am I going to die?
You have some patients that it's obvious what's going on, you've seen it so many times before. And then there's other times where, well, you really don't know what's going on, and it's almost... You're not gambling, but you're playing the odds. You're thinking, what's the most likely diagnosis?
78-year-old Reginald is a retired dock worker from South London. He woke up this morning with severe stomach pain. Reginald also suffers from diabetes.
Okay. Do you know where you are right now?
No.
Do you know roughly where we are?
No.
Do you know what kind of building we're in?
Hospital.
That's it, we're at King's College Hospital.
Kings.
Yeah, do you know what year it is?
8.
10. Do you know what day it is?
Tuesday.
Tuesday. It is Wednesday. Do you know, it's close though. All right, fine, just relax for a minute. Obviously, I'm really junior and I try to give off this sense of calm aura. Even though inside myself I might be bricking it, I want the patient to feel calm, because if you look scared, they're not going to feel very comfortable, are they? It's fear and excitement. You've got this person in front of you, they've just come in, and you're not really sure what's wrong with them. All you know is they're not well, and whether you don't know what's going on because your experience, because you can't get any access, you can't manage them, whether you just don't know what's going on, and you're scared of someone probably just dying under your care. I think that's really scared of.
I sort of quite like to stay distant from patients as far as possible. Well, sometimes things that are more interesting and you feel more passionate about, you get more involved. Sometimes any father-like figures, there's the potential to be emotionally attached to them, I guess. Reg, how are you doing now?
I feel terrible.
Yeah, okay.
I'll be honest with you.
Yeah, no, that's understandable. That catheter hasn't made a difference, has it?
No.
You still feel and look quite rubbish, don't you? Okay, okay. Yeah. Before my dad died, he was actually living abroad, so every time I would go out to visit him, he would introduce me to his university colleagues or his neighbours. This is my son, this is Dr. Feras. That's how he'd introduce me. And you could just see his eyes light up with pride. He was, yeah. I'm glad, out of everything, I'm glad that he saw me become a doctor. You know, I still remember his face at my graduation. I've got a photo with him. I think it's the only photo I've got in recent memory where he's actually smiling. It's nice. I've got that up in my study at home. Do you know if anyone's phoned his wife?
Well, LES said that they were following by car and they haven't come in yet. Shall I give her a quick phone call?
Yeah, if we've got a number, that would be brilliant.
Hi, is this Mrs. Brown? This is daughter. Hi, my name's Dominic. I'm one of the doctors at King's College Hospital.
It's getting worse. I'm really worried about him. He's had 5 litres of fluid and his lactate's going up. What we're doing, I'm sorry, I should have said, we're going to go up for a scan of your tummy. Just to...
I've done this.
I know you're not feeling very well. You're not very well, I know. I'm really sorry. Now and again, a handful of times a year, I will get a patient where I will spend more time with them. In his case, I've spent, you know, a good few hours with him, and he was the first person for, you know, a good while that had got me that attached. Okay.
Reginald is suffering from a severe stomach complaint that doctors have yet to diagnose.
There's a few things that upset me. If you've got someone unwell, especially if it's someone that's previously completely fit and well, and the patient isn't getting better, I find it really difficult.
This man is going to die if they do not take him to theatre and explore. His lactates. The results of the CT was a bit ambiguous, but he had this really bad metabolic acidosis with this high lactate that was getting worse despite giving him all the treatment. His pulse rate was on the high side, he was getting more agitated and more drowsy, his belly was getting more tender. And I was that worried about him, and I genuinely thought he was going to die in front of me, you know, there and then in resus. I'm gonna try and phone your daughter again and say that I am quite worried about you and try and get her to come in. I know she had an appointment, but I think it's quite important that she does come in. It's not just about him. It's about his loved ones. If my dad's about to die, as his son, I would want to know that that's going to happen. His wife was a bit vague. She said that she knew that her husband was in hospital, but wasn't very clear on why he was in hospital. And when I asked her if she was coming up, she told me that she couldn't come up. And then, as we gathered more information, it dawned upon me that I think that his wife had memory problems herself, and maybe even had dementia. And I suppose that heightened things a bit further. Is that like you? Yeah. Hello. Hi, it's Feras, A&E consultant. Did you happen to speak to your boss? Okay, I really need someone to come and review this patient, please. I'm going to be blunt, and I'm going to say this patient is going to die if he does not get critical care input. The lactate's gone up to 9.8 now. What might help is if someone comes and reviews the patient, and then you can discuss your findings with a consultant. So if someone could do that, that'd be brilliant. And I'm going to get a hold of the surgeons and the medics again. Thank you. I felt frustrated as things weren't going as I wanted, and I've got attached to him as well because he was stoical, he was friendly, and he was actually a genuinely nice guy.
Reginald been seen by our surgical colleagues who felt that what he needed to have done was to go to theatre and have an exploratory laparotomy, which is an operation where you open the guts up and you have a look and see what's going on, usually to find dead guts and remove it. And if you don't do that, you will die if you have dead gut within you. If Reginald had decided, on balance, I don't want that operation, I'm of sound mind and, I don't want it and I don't need to explain to you why I don't want it. That's okay. That's up to him.
Is it a big operation?
It is a big operation. I must tell you it is a big operation and it will carry risk. It's naive to say it doesn't carry risk. It's a big operation, it does carry risk. But compared to your risk of dying without it, that risk pales into insignificance, in my view.
Okay.
All right.
Any resus? Surgical register? Hi, have you just been with Reginald Brown? Okay. Feras, the surgeon said they found nothing, they just opened and closed.
You are kidding me. You are kidding me.
After almost 3 hours, Reginald is out of surgery. Despite the doctor's worst fears, it turns out there was no dead gut to remove.
My first reaction was overwhelming relief because I knew that would be best for Mr. Brown. And actually, would I do anything different? No, because in that situation, the number one life-threatening diagnosis is ischemic bowel. But then also there's that little element of disappointment where you think, oh, I was bloody sure that was a bit of dead gut. A lot of things in medicine are mysteries, so we don't always have the answers, unfortunately. If we did, then, well, we'd be very special.
The medical staff believe his original condition may have been caused by an accidental overdose of insulin brought on by the early stages of dementia. Reginald spent a further 3 weeks in hospital where he received more treatment for his diabetes.
take one day at a time. My dad always says that. Day at a time. I'd be lucky to be here. If you make life what it is, you enjoy it. Oh, there's rough times, I know. But on the whole, my life has been a happy one. With the people I've been surrounded with the family, people outside my family. Wonderful days and wonderful times.